So on behalf of CHHSM, I wanted to welcome everybody this afternoon. I'm George Graham. I'm Vice President with CHHSM, and I'm very excited about this webinar this afternoon. I think all of our members deal with issues around staff recruitment and retention. And I'm excited to be able to present this webinar that focuses on those issues in partnership with Fair Purchasing Services, our partner at the CHHSM store. So I'll turn it over to Natalia Hernandez, our representative with Fair Purchasing, to introduce our speakers and get things going.
Thank you, George. Good afternoon, morning, everybody. Thank you for being here today. My name is Natalia. I am the Client Account Manager at Care Purchasing Services for CHHSM. So glad to be here. Today with me is Quinn Adair. He is another Client Account Manager that will be supporting our CHHSM organization with any questions or any vendor programs moving forward. So you're going to see him more often, and you're going to get to see his name on different emails and communications moving forward. So excited to be here to be part of this webinar today. Today, we are going to be talking about recruitment and retention. And for that, we reached out to two of our vendor partners. We're going to start with LeaderStat. They've been a vendor partner of CPS for over a number of years. To lead that conversation today, we have Julie. She is the Director of Recruitment for LeaderStat, and she's going to be talking today about their services, a quick introduction to who they are and what they do, as well as giving us a quick overview of the different online platforms that we have available for recruitment activities. She's going to touch also on some reputation management, and then of course some strategies as to increase employee satisfaction and increase employee retention, which is obviously a big topic nowadays with everything that's going on in our world. So having said that, I'm going to pass it over to Julie so she can start the webinar. And if you have any questions or comments, please feel free to add those in the chat box. Quinn is going to be reading those questions, and he's going to be helping us to guide the conversation. So thank you again for being here. Julie, pass it over to you.
Thank you so much. Thank you so much, everyone, for asking us to join today. It's certainly the hot topic. When we ask all of our clients what keeps you up at night, staffing and recruiting is hot on the list. So hopefully we'll be able to go through some strategies today on how to attract new talent to your organization, but then also how to, once you've done all that hard work, how we're going to keep them there. So let me just share my screen with you here. Here we go. You see that? Okay, very good. So I changed the title up a bit because we're going to hone in on a few digital recruitment strategies. So wanted to make you all aware of that. LeaderStat has actually been in business for 22 years, and we started off just doing interim work for the post-acute space, and now we do recruitment for the acute care side, post-acute, home care, and various other healthcare organizations. So we feel like we really are part of the workforce solution in post-acute and acute care. Just a couple of fun facts. We've been in existence since 2000. We have 3 offices. Our corporate office is here in Columbus, Ohio, go Bucks. And we also have a Charleston, South Carolina office, and then a Scottsdale, Arizona office that has permanent recruitment out of that location. I clearly picked the least exotic port to work from, but that's okay. Just a little bit of background on client satisfaction. We have an 85% rating. Many of our clients come back after we've worked with them, and we pull a lot of our folks from our network after being in business for 22 years. So just a few fun facts there. Okay. Social media, how to attract candidates. It is a very different world out there. I've been in recruiting for 20 plus years, and never did I think we would be doing the strategies that we are doing today to attract top talent. We're in very much a candidate-driven market, which means they've got lots of options out there. And so we need to find ways to differentiate ourselves. And many times that is on the social media platforms, as well as really honing in on what makes us different. And as I look at the CHHSM organization, just aligning with your values and your mission, you already have a step ahead because you've got a wonderful story to talk about. So there has to be ways that you highlight that within your organization. So there's many, many options on social media, but the thing to talk to your folks about within your organizations is, how do you get, when someone Googles something, how do you end up on the first page above the fold? So there's definitely strategies that will help you to get top of mind when you Google recruiting in the post-acute space. Our hope is that you see LeaderStat pretty quickly, and there's lots of what I call behind the scenes action going on in order to make that a possibility. So looking at what your options are, obviously LinkedIn, YouTube, Instagram, Facebook, Twitter, and TikTok are the top platforms that folks talk about when you are looking at social media and how you're going to decide to do that. What it does is it really strengthens your brand. We have been in a hiring mode here at LeaderStat, and a lot of times we'll say, how did you hear of us? And they either Googled us or they saw us, our Facebook page, and they said, we love the content that you guys are putting out there. It looks like a fun place to work. It looks very engaging. We talk a lot about our core values, that we hire based on our core values. And we talk about that on our social media platforms. So it highlights what your culture is and really helps you to put a face with the name. And ultimately, people are looking to apply to jobs when they go, that really makes sense to me. That really resonates with me. You'll be able to attract more individuals to your website. So we're going to break down a few of the platforms. LinkedIn is really a platform that focuses in on the professional, the higher level positions, if you will, leadership positions. Some of the titles that we source on LinkedIn, but also when we post, folks come to our website are administrators, executive directors, more of the regional role, admissions and marketing, and a lot of the clinical staff. So they say 30 to 49-year-olds really utilize LinkedIn much more frequently. 51% of college graduates create their first LinkedIn page right when they graduate, because it's their first venue into the professional life. So 59.1% of the users are the ages 25 to 34. I would say that's probably a little low on the age range, but that's some of the statistics that we pulled for this. The other is Facebook. Everybody has a Facebook. My mom has a Facebook, and she just turned 80 last week. So she's very active on Facebook. So I think the age ranges range really from 20 to 80 on Facebook, but it's the leading social media platform. So we have professionals, we have the paraprofessionals, and the direct care staff that are really active on Facebook. 74% of the users check Facebook at least once a day, and 51% check it several times a day. I don't know how many of you are guilty of it, but if your phone is sitting next to you, you're going to look at it at least 3 or 4 times. Let's just be honest. So it's a way to stay connected with family and friends, but we really encourage our folks, at least here at LeaderStat, to like anything that we post on our professional Facebook page. As you know how it works, the network just continues to grow the more people share and post the content that you're putting out on Facebook. The Facebook applies to all positions, where LinkedIn really hones in on the professional side of it. Facebook really covers all management as well as direct care staff. So the other platform that we utilize is Instagram. And this is geared more towards the 18 to 34-year-olds. 60% of them utilize Instagram. This is much more of a visual as opposed to any type of wording. That it's really more a picture sharing. So you want to have really solid images that show engagement, can attract new folks to your page. Last year, 55 to 64-year-old males utilized their Instagram utilization increased by 63%. So it's definitely starting to grow. Where Facebook is number one, I think Instagram is a hot second to that. TikTok is one, I'll be honest with you, it's not one that I utilize, but we hired someone specifically here at LeaderStat to grow and advance our social media presence. And so TikTok has the small snippet of videos that people watch. This really resonates with some of our younger professionals or the paraprofessionals that are coming into the workforce. So we had our CEO do a small snippet video, and she goes, "I can't believe I'm doing this," but it had a lot of likes, and we really got a lot of traction from it. So don't be afraid of it. Ask those younger folks that are really active on these platforms, and they're happy to share what their experience has been. So what platforms are you going to use? I mean, we talked about briefly some of them. The ones that I'd like to really kind of hone in on is Facebook and LinkedIn. So really just to get started, you want to create and update your company page. Make sure that it's as detailed as possible, because people, when they're sourcing or looking for your type of organization, you punch in those keywords. So make sure that your company page really resonates and is fully completed. You get more bang for your buck when you add images that show happy people. They're clear images that are easy to see. Oh my gosh, they're clearly a healthcare organization providing services to folks. Include your contact information. Shame, I'm gonna give myself away here. I had a client say, "Julie, I tried to get your number via LinkedIn, and when I went on your contact information, my phone number wasn't there." And I'm a recruiter, so I need to make sure that I'm easy to access when people need to reach out to me. So encourage your teams to this really takes a village to get that network as in-depth as you possibly can. So whenever anyone from our organization posts something, whether it's a internal job, an external job, that we've got DON openings in Texas, or we have travel nursing opportunities in Ohio, we put images, and we always encourage we have contests here at work to see who's our most active on social media. And it doesn't have to be something really costly, but those contests really increase your involvement with liking, sharing, and just think about that ripple effect. So if I have 500 plus followers and I share or repost something, think of the impact if all of us do that with where that information is going. So it's astounding, and it's such a simple fix. So I would encourage you to have contests and get your folks involved in really getting active on your social media. So tips for posting on social media. If you look at this image, the LPNs, you clearly see that someone wants you to join their team if you're an LPN or an STNA. So it's very clear. It doesn't have a lot of background noise in it. And it's a really nice image of somebody that it's really clear that they're looking for clinical. Be brief. You need to find what they're looking for, and then be able to click on something that's going to take you to the full job description, where the location is, what the pay rate is, those types of things. So your image out there is going to be nice and crisp, and then it's going to take you to that next page that will help you to understand the position much more clearly. Don't post it and forget about it. If you are posting out there on social media and you're not getting return, and you say, "Gosh, I posted that out there 2 weeks ago and I've only had 2 responses," change it up, change your wording, refresh it, because you know what people do is they'll go, oh my gosh, that was posted 4.5 weeks ago. I'm sure they filled that position by now. And so having someone monitor that, I would say every 4 to 5 days. Again, having someone responsible for your social media activity is really important. And change it up. Make your images look different, make it look fresh. And then also utilizing the groups. I don't know how many of you have ever looked at how many pediatric healthcare groups there are on LinkedIn or Facebook. I know that we did a webinar a few weeks ago for a home care group, and I just pulled up, because I just wanted to see how much activity there is out there for home care. There was a clinical home care. They've got only for leadership on the home care side, job posting sites, travel, what it feels like to be a traveler, and tips and so forth, and different blogs. So utilize those groups because you can get in there and really get your word out, start networking and building more your pipeline of folks that you can hire in various positions. There's always a cost if you're going to boost your post, and that's where you can post it. You boost the post, and it typically costs, I think it's $200, but you get more traction. And again, you land on that top page as opposed to clicking through. How many of you would ever click to page 2 or 3 when you Google something? You just don't. You look at that page 1, you see what's there, and you feel like that's going to give you the best return. And so if you're not doing things like search engine optimization and other types of content that are making folks attract to your website, it can really, you'll land on page 3 and it's not going to give you much traction.
Hey, Julie, quick question.
Yeah, you bet.
All right, George asked, and this is to clarify, are organizations creating social media profiles specifically for recruiting or just using the main page for their organization?
So you can, it's twofold. You want to get what your organization is doing, particularly one like CHHSM that's got a wonderful mission. So folks probably don't know the various sectors of all the areas that you all touch. So making your Facebook page, your face page, if you will, as clear as possible, but then you can also use it for recruiting. You can use it just to send out content. It increases people coming to your website, and so that you do land on page 1. Did that help? Hopefully.
Perfect. Yep, that was on behalf of George. Natalia asked, and I think you got to this a little bit, but in your experience, should organizations always list current job openings? Is that separate than the postings that you mentioned to always kind of keep it running?
You should always list, you should have something on your website that's so easy to see where your careers page is. Don't make people click on 3 buttons and then scroll down and go, oh, here's where their openings are. You should have a button that's highlighted that says current openings and make it on your web, the first thing that your landing page, excuse me, I'm losing my words, the landing page of your website. So don't make people dig and click 3 times in order to find what your current job openings are. And then every single, if you are posting one single job and you boost it, there should always be a link at the very bottom to view the full array of jobs that we have. Please visit our website, and then it should be easy to click there. So don't just use that post for that one position. Really draw people to your website so they can see all of the current openings that you have. Okay. Okay, just another for Facebook, be brief to the point. It's this is really easy. It tells you what you're doing, what organization, so it gives you some ideas. And then if you see the impact here, they had 17 shares. So again, I have over 500 connections on my LinkedIn. If I posted it and 17 other people or 16 other people posted it, this one ad is getting lots of traction. So it got 67 likes, but this is more important here as the 17 shares. So I think this went back to just the type of team-focused content. You don't want to always use the same mantra. I have a administrator opening in Cleveland. People will scroll right past that. So you need to change your content up to how to reduce stress as a leader in healthcare. So you're pushing out more than just what your job openings are. You're attracting people to your organization, and then they'll go to the various. So also, again, making it easy to apply. One click. You shouldn't have to go through 2 or 3 clicks. And then invitations to various job fairs. So really changing up your content is critical for your LinkedIn. This, when you're posting and you're looking for pictures to post on your social media, so we're telling you guys to have really nice, crisp images, but there is an issue with copyright. So this is an array of other types of places that you can go to get content for posting that is free. So Canva is one of our favorites. So if you go to canva.com, they've got really great, clear healthcare driven pictures that are for free. We had a client that was just Googling and put a picture up, and they got fined $6,000 for a copyright. So it can really shoot you in the foot. So make sure that you're looking at places that you can get images that are for free and you're in good shape. So why invest in social media? There is a cost to it, but when we ask folks about how did you hear of us, 58% say, I saw you on Facebook or I saw you on LinkedIn. And we have really found that when we have been much more active, 44% of the recruiters that were polled said that it really helps with the increase in candidate flow and the quality of candidates that are seeking our jobs. So we're going to shift gears quickly here to reputation management. How many of you, when you go to a brand new restaurant, you look on Yelp or you do a Google review and say, I'm going to go to the Pearl, and you see, oh my gosh, it got 5 stars. Look at all these wonderful reviews. You're excited to go. That can also be negative, because what if it's a 2-star and they say, I would never go there. The service was awful. My food was cold. You're going to go, I'm going to go to my tried and true and go down the street to the Windward. So they do the same exact thing for your organization. They look to see what star rating that you have out there, what the reviews are on Google and Glassdoor. So it's a very big deal. So online reviews are a big deal. 93% of folks said that they read reviews online and it either attracted them towards that business or away from that business. So pretty serious stuff. They make your center look trustworthy, or your organization look trustworthy, when they can go and go, I feel so much better that I'm going to be providing services to my child, and it's a 4-star rated. Got some really great reviews. I'm excited that we selected that organization. It helps them to make their decision. If there's a bad review out there and multiple bad reviews, people will look for other organizations to join, and it makes you much more visible when you're out there and you've got reviews. So this, I'm going to breeze through these quickly, but the point is you respond to all reviews, good or bad. If you don't respond, people will feel like you don't care. And even when you get a lovely response like this person did, they even gave the shout out to the person that provided such the good care. And then the CEO said, thank you for your heartfelt note. So that is the perfect example of how to follow up. Here's a review that was a bad review, and we kind of broke this one down. They didn't ask to make it right. They just directed them to the executive director. There's 3 things to remember when you're addressing a bad review. And I will share with you, all organizations, there's someone that gets upset regardless of how good you are. And regardless of your intentions of you want to be the most caring and top-notch healthcare provider, someone will be upset, whether it's an employee that felt like they were not heard, a family member that maybe had higher expectations than you were able to provide. So everybody gets a bad review, and the way that you deal with it is that you apologize for the misunderstanding or the service failure. You ask them to please reach out to you directly so that you can make it right. You don't get into a conversation with good or bad on these reviews. So you don't respond, well, I'm so sorry that you felt that way, but ... You always take it offline to make it right and work through the organization that way. You don't want publicly to see maybe a potential argument online. And these things don't go away. No matter what you do, you can't get rid of them. They're on there forever. So it's good to address it, make it right. And then what you want to do is have folks kind of bury it with good content. And we'll go through that next. So this was an awful review, but look at when they said, was this review helpful? 16 people found it helpful, which means they were probably like, well, I'm never going to utilize that group. So it does make a big deal. So how you deal, don't ignore it. You should apologize and then take it offline. I'm sorry, I think I missed a slide here. Nope, I didn't. So take it offline. We already went through that. And then how you increase those is you drown out those negative reviews. So you ask people, whether it's clients, current employees, to give a review of your organization. If they've had a wonderful experience with your group, they're going to be happy to give you a review. And you have to make it easy for them. So you either tell us how we did on your signature line and they click a link and they're able to give a review, or you can send them something and say, if you could please share a few sentences about your experience working with our group and help them to post that out online. So drowning out those negative ones so that when you do Google, again, if they don't go away, they're going to see all of those positive reviews on what it's like to work there or what it's like utilizing your services. So I had a lot of content, so I want to make sure that we can cover everything here. So we talked about how to attract people, how to get them to your website, but then you're also going to want to keep those folks. So retention strategies start when the minute that they say, I accept the offer, you guys have to start putting in place how you're going to keep those folks engaged. So creating a positive candidate experience, particularly in this candidate-driven market, is critical. I'm going to move our little box out of the way here. Sorry. So some retention strategies for folks in healthcare. The big thing that we're hearing about is the buzzword of work-life balance, and that's different for everybody. A lot of times what they're looking for is flexible schedules. If you've got per diem staff that are coming on board, can they get paid the same day? That's a big question for when we place direct care staff and STNAs. We are able to get them paid on that very same day. So educational offerings, do you offer continuing education to your staff, free or paid? And then what type of bonus programs that you have? Recognition programs. They're so easy. They do not need to be costly. We give $10 Starbucks gift cards to folks when they do something that we think is worthwhile, and you think we gave them $100. It's just a nice trip through Starbucks, and it's easy, and it helps to keep the engagement up and going. So when do you know, like, who's ready for career advancement? And this is just some soft skills. When you think of your organization and you think of all the rock stars, and you know which ones, like you can close your eyes and go, that person is going to be with us, and I want them to be able to grow and develop and advance their career. They're the ones that exhibit these types of soft skills. And soft skills are something that is tough to teach. Or tough to teach. So I would rather teach them the specifics of the job as opposed to really having to see if they're empathetic and they manage their stress well. Most of your rock stars really embody all of these soft skills, which is wonderful. We
Julie,
did a survey.
I'm gonna take the last minute to close. Sorry to cut you off.
You bet. So just creating a career ladder. I know that was a big component. of when we did our group, they wanted to know, well, where will I go here? You know, if I come in as a recruiter, what are my opportunities? So creating a career ladder for your folks is critical. And so lastly, key takeaways: create and implement retention strategies when you get new hires and they realize that there's a career development and you're really focusing in on where they can advance. It's going to make your organization one that's the top healthcare provider, and they're going to really seek you out. So I wish you all luck. Does anybody have any questions? I'm sorry I went a little over, Vince. Chatty.
Perfect. I think we had one more come in talking about cover letters, and we may circle this conversation up offline and make sure that we get to the bottom of all of these. But I think really some awesome content, Julie. Thank you for taking the time to go through all of these. Definitely good takeaways and, you know, action items to put in place for a relevant audience here. So, and just based on hearing Vince's some of Vince's presentation previously, I think it's a good segue into Vince Biera with Relias, another great partner of ours at CPS. Vince is going to get into onboarding employees to ensure retention. So again, kind of that nice handoff here of focusing on that onboarding and retention piece. Very quickly, I want to introduce him through a bio. Vince Biera started his career at the Cleveland Clinic and Duke University Hospital as a cardiothoracic ICU nurse. Moving on to work as a traveling ICU nurse, Vince worked in more than 15 hospitals across the U.S. and U.S. Virgin Islands. And George, I might have you hand over controls to Vince so he's able to get his content up while I finish his intro. Perfect, thank you. So he went on to become the lead faculty member at Central Nursing College, a one-year accelerated LPN school. After years of consulting, he switched to the business side of healthcare and now strives to make a measurable difference working with organizations to solve their biggest problems around staffing, retention, and patient care. Vince is also an international best-selling co-author of The Nurse's Guide to Innovation, which teaches nurses how to develop and launch their business and product ideas. Vince is also the founder of Step 2 Health, which offers proprietary assist devices for seniors to help them reduce their risk of falls and age in place. The Step 2 Health products are sold nationwide with partners like Walmart, Lowe's, Amazon, CVS, Walgreens, and more. Vince currently lives in San Diego, California, and is married with twin boys. So Vince, I'm going to turn it right over to you. Thanks for being here.
All right. Thanks everyone for the time. We're going to try to hustle through this, and I may jump around a bit, but excited for the conversation. Thanks for the intro. And let's jump right in, right? Because everybody has the same issue as discussed. How do we keep these staff with us longer? And so where I'm going to start today is really the groundwork, the framework, the foundation that you're going to need to ultimately prepare people that are either in your communities that want to move to a new role, or people that are coming into senior living for the first time. So these things really start at the beginning. Like Julie mentioned, that retention starts right when you hire them, right when they're onboarding. And where I like to start is really helping them understand big picture what your community is about, what the pace is, what the rhythm is. Are you an IL, an AL, a CCRC, a skilled building? Help these people understand what to expect, right? And you'll be able to go further and deeper into all these topics. So again, I'm not going to spend quite as much time. This is an hour presentation condensed into about 20 minutes here. So we're going to keep the momentum, but this is your chance to brag, right? And really talk about the kinds of senior living that your community embodies, because these young people, they don't always understand what the differences are. And you can see them listed on the screen, right? So you've got things like village concepts and residential care homes, ALs, ILs, as mentioned. So we really want to go slow with these people, help them understand that continuum so they know where they fit in. As you continue to go through, there we go. Talk about what's new in your senior living community, right? And this is your chance to really brag about your community to the new hires. Talk about the ways that the industry is changing. Talk about the impact that you're having, because this is really your chance, again, to help attract these new people. And all your communities that you're a part of are doing unique things that are interesting, right? Catering to new needs, there's new amenities, there's designs, there's all sorts of things that help evolve the industry and your communities as a whole. So this is your chance to brag. And everybody knows in that job post that you're going to list, pay is important, but you've got to touch on these other foundational items that are going to help paint a picture for these people that are coming into your community. And what I like to do is talk about the benefits, right? Because the pay, again, only goes so far, but you got to talk about how you can make a difference. You got to talk about the flexibility that you and your team offers, and the team that they're going to be around, right? How that companionship is going to change their day to day and give them some value, along with providing dignity to the residents and building professional development and relationships. And here's a key takeaway I want everyone to write down. You don't want to always talk about how it works. You want to talk about what it does, right? You don't need to go deep into every single in and out, right? But you want to talk about that end result that you're going to provide through those actions. And you've got to talk about early on the emotional side of the job, because this is one that grabs people and shakes them and says, I don't know if I want to be here. So you've got to prepare them early and often for the good, the bad, the ugly. This is the residents' families yelling at you. This is somebody forgetting who you are because of sundowning syndrome, or even death and dying, and how that impacts the relationship that you have with your staff, your team there, and that resident and their families. So you've got to be upfront with people. You got to show them how they're going to make a difference, because I can assure you every single one of these new hires is going to have that oh crap moment where they just start to scratch their head and say, is this where I want to be? But if you can preempt them and you can help paint that picture beforehand, it's going to go a long way. Help identify with these young people who are the residents in senior living, right? Mostly older women. You can go through the age groups. You can talk about, again, men versus women and the total number of residents. Help paint a picture for these people, right? How many folks need help with those ADLs? So these are all things early and often that you need to go through. Now, there is some parts here about the acute care side we're going to skip over, because I want to really make sure we're getting through the crux of this. But as you start to get through, that initial attraction of candidates, and you start to talk about the big picture of hiring and getting them onboarded, we want to dive deeper into some of these other aspects. And this is really to help keep people with you through those first 90 days. It is absolutely crucial, as we all know. So let's talk about some of these key drivers of turnover, right? The wrong expectations. We just talked a little bit about that, right? That oh crap moment. You got to really paint a picture. If you're an IL, the care is going to be different than a skilled building. And I could go on and on. You all know those things. Next is poor training and poor onboarding, right? So this is really your chance to challenge your team, right? Have some introspection here with your staff, with your team, and really find out what ways can we make this better. You've got to dig deep and really challenge yourself to make sure that your team is providing the best experience, because you only get one shot. And every single place down the road is hiring these people for a quarter more an hour with the sign-on bonus, and they're bragging about what they're doing. So if you don't deliver on this onboarding process, these people are going to tune out, they're going to leave, and you're going to be back to square one. And then inadequate support, right? You've got to make sure that you're checking in with all these people through all these weeks of onboarding to get them ready. And I'd love to just, typically we have a little a quiz, a pop question quiz here to see who in here thinks that their organization has their onboarding dialed in, right? Yes or no? Is your onboarding dialed in? 100%. This thing's ready, right? We don't really have the capability to get a yes, no answer, but I want to challenge you to think through that. If the answer is no, I want you to take some of this insight and hopefully go back and challenge your team to say, where can we make improvements, right? And there is no silver bullet. Okay, let me repeat that. There's no silver bullet that's going to solve your problem here. You've got to take 5% better here, 10% improvement here, and you got to combine that. And all those things, like Julie mentioned, all these small tricks, all these little improvements that you can do are going to also allow you to provide that better experience, right? So challenge yourself here. What do employees love about your healthcare organization, right? This is the satisfaction they get. And these are all things you've got to really pound into their onboarding so they have some good takeaways, right? They know what to expect. They know where this is going to lead them and take them. Being a resident advocate and a patient advocate is really fulfilling. I can tell you as a care provider myself, it's one of the best parts when you know that you can really help people get through their day. and handle those tough situations. And then positive examples of crafting, right? When they can take their own way of doing things and kind of apply it to the care is really a way that so many young people get fulfillment. Now, what are some things they dislike about the healthcare environment? And that's number one, being disrespected by management, or they perceived management as being incompetent. We've all heard that people don't leave jobs, they leave bad managers. And boy, is that true. So again, where are your shortcomings? Where can you pour into your leaders to provide that better experience so it trickles down to those frontline staff that you've got to work so hard to keep? Next is unrealistic expectations. I can tell you, being on the front lines, that there's times where people are like, well, why didn't you do this and do that and do that? And you're like, I'm only one person here. I've already am overworked. I've already got such a heavy assignment. Make sure that your team is doing whatever you can to keep those expectations in line with normal. Lack of a career path. Julie talked about the importance of it. Boy, this is something that young people need. Okay. You have to invest in creating this. Relias has helped customers. I didn't even go into how we help serve people. We work with 11,000 healthcare organizations, over 4.5 million caregivers across America and the world use us in some form or fashion. But that career path is one that we can help people really provide. But you've got to make sure your organization has something in place, because it's not just the pay that's going to keep people. You've got to be able to show them that next step in their progression, right? And then negative examples of crafting and ways that you maybe put restrictions on your staff to have some freedom. So here's some things that you can do to help hire, whether it's CNAs or other frontline staff. And these are maybe some good questions to jot down if the presentation doesn't get sent out afterwards. Is try to understand why they want to work in the industry, right? Help understand what separates them from other staff and what maybe you can come to expect from them. Let them brag a little bit. Ask how they feel about their last boss, right? Try to get some insight there to figure out what exactly they're going to say, right? They might tell you the truth. They might really start, talking bad about their last person, and that will maybe give you some insight as to them. And then maybe what moment are they most proud of as a healthcare provider? Quinn, maybe you have a question or?
Yeah, thank you. Real quick, Tom jumped in and said, what is crafting? You had mentioned previously.
Crafting is an employee's ability to provide their own approach to a care delivery model. So if maybe the book says to do it one way, and over on the floor, you kind of learn the real way it gets done, and then staff get to kind of put their own twist on it. Now, you've still got to deliver the care in the appropriate manner. So you can't let people get too far outside the guardrails that, are there. But at the same time, you do want to give some of these people, they're going to do it anyway, some of that freedom, right, to really make sure the care is being delivered well. Okay. Anything else?
Perfect. Nope.
All right. Now I've got to come clean. I am a millennial. Please cut me some slack. I'm a millennial. I'm right at the front end. So I didn't get a cell phone until I was a senior. I'm still, I think, a hard worker, all that good stuff. But these are things that you've got to do with millennials to really make sure that they're engaged, right? Hiring in advance. This is where you get to talk about how you envision them fitting into the workplace. This is where you get to paint a picture. Millennials really need short-term rewards, right? You can't say in a year from now, we're going to do a review and we can't wait to see how you do. It needs to be quicker. We're going to talk more about that. The 5-touch rule, right? Julie mentioned, as soon as they give you that yes, boom, hit them with a text. We can't wait for you to be a part of this. Boom, the email comes through. Boom, hey, when are you free for that first onboarding? Hey, we got to have you come in, right? Boom, 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 boom. We can't let that recipient be on the other side waiting a day or so. That sounds like a lot of work, but you have to put your best foot forward to really make sure that engagement is there. Next, establish and celebrate quarterly goals. If this is the one takeaway that you have from my talk, it's this part that I'm really going to press on you. You want to know what builds culture? This is what builds culture. You knowing every employee, knowing everything that's important to them. That's culture. Not pizza parties, not swag. It's you knowing each person and what's important to them. So what's important to Julie, what's important to Quinn and George and Natalie, and everybody on your team is going to be different. Some need childcare. Some need help with this, with that. You've got to know each person, and you've got to set quarterly goals with them. Hey, those goal sessions, they're free. They don't even cost anything. For you to slow down, get to know every single person, and know what's going to make them tick. Because sometimes it is money, of course. Sometimes it's not. But it's your job to really know. And through that, you can show them the growth opportunities. Hey, if you do well in 90 days, we can move you up here. We can move you over there. You can move to our float pool. We can offer you this. We can do that, etc. Right? But a year from now, it feels like eternity to young people. They won't even sit through a video that's more than 2 minutes long. Shoot, probably more than 1 minute long. So a year from now is way too long. Quarterly goals, 90 days. Show them, paint that picture where they can go, and no HR surprises, right? If you're going to hire them, you're going to do something, don't try and throw them a curveball at the last minute. Okay, how can you engage millennials through the hiring process, right? Look beyond the resume. So many of these young people, they haven't been, I hate to say this, kind of brought up with the same level of importance of some of the things that the older generations really deem to be important. I saw the question earlier, our cover letter still a thing, right? I'm not saying you should allow people who don't put their best foot forward into your communities, into your organization, but you have to look beyond that because talent is scarce. You got to keep an open mind about job hopping, right? So many times that's a turnoff to us as employers. But with the younger people, they don't feel that same affiliation to give yourself to a company forever until they really do you wrong, retire you, or fire you. No, the younger people, they're going to bounce and move and find what fits them for all those really work-life balance points that Julie made earlier. So got to keep those things in mind. The meaningful work is front and center as to why so many people will want to be in your communities. All the things that you can brag about, the ways that you can make the impact. You've got to stick through that and continue to reemphasize those things and remembering their needs, right? This is hard to do. This is those quarterly goals. This is pouring into each leader, into each person, and getting that waterfall effect. Okay. So what's the best way to implement your way of doing things, right? And this is where you get to improve those orientations, right? Is it dialed in? Or is there room for improvement? I want to challenge you to really be introspective there. Next, provide more site-specific training and provide more in-house training, right? Any micro learnings you can do, small sessions, 10 minutes here, 20 minutes there. It doesn't need to be an hour in front of a screen every time you want to teach them something, okay? How do millennials learn? So this is important. Visual, auditory, kinesthetic. How many times have your leaders slowed down and thought, is this person an auditory learner? You know, if someone says, I hear you, they're telling you they're auditory. I feel you. I know how you feel. Kinesthetic, right? Visual. I see what you mean. People will tell you these things with their verbiage. I could give a whole couple-hour presentation on this topic alone. I really love the psychology behind these kinds of small things, right? But this is how you elevate yourself past your competitor down the street. When your leaders can really go deep into some of these things and meet each new hire where they're at, you're going to really get great responses and better engagement. You got to make it relevant for young people. And this is important. You got to provide rationale. So many times in healthcare, and I've been there, right? Where this is the way we're going to do it. Well, why? Well, because this is the way, right? This management said, the rules, the regs, etc. I need more as a young person. I need you to explain why around almost everything, because that's going to get me bought in. And this is hard to do. This takes extra effort, but you've got to slow down and really make sure these people understand why it's so important. Why is it good for your team? Why is it good for the resident? Why does it help us bill easier? Why does it help us avoid penalties? You could go on and on, right? Keep the environment relaxed, build rapport. This means slowing down and getting to know people. This means as a leader, even letting your guard down, because so often we want to keep that professional manager relationship, right? And again, to each their own, but you've got to continue to work on these things. All right, couple more slides. We're closing in. We're going to leave a few minutes for questions, and I know I'm going fast, so I hope I'm not, losing anybody here, but here's some simple ways you can improve employee engagement. Make it a priority. I know if it's not on my calendar, it's going to be hard pressed to get done, right? Schedule time every day. Let me slow down and say that again. Schedule time every day to make it a strategic priority. And this is hard to do because you're busy. I know that. Next, find the right managers and really define those engagement goals. If you're not defining those engagement goals, it's really hard for someone to have that North Star, just know where I have to get to. What is considered good in my role as I continue to onboard new people? So how do you prepare these clinicians, your best people, to be good managers, right? First off, it's not about you, it's about them. Take your ego out of it. And this is hard sometimes because we're so proud of the work we've done, the environment we've created, the infrastructure we've built, but it's not about you anymore. It's about this new person that you're grooming to be a great leader. And it's important that you continue to pour into them. Next, assign a mentor for that good clinician who wants to be a good manager. Maybe it's you, maybe it's someone else. Sometimes we forget that even people moving up into those higher level roles, they need a mentor too. And boss is about being a 50-50 split. I love the old saying, you take a step, I take a step. You take 2 steps, I take 2 steps. If you don't step, I don't step. This is important to really drive that message home, to get these people to be a self-starter, right? And most of your leaders who you're going to oftentimes promote are those self-starters. But again, you've got to really set clear expectations and define what those look like so you can have success. Couple more slides here. What do employees want from their managers? They want to be heard. They want to be appreciated. Again, slow down. Julie mentioned $10 gift cards. They don't always need to cost millions of dollars to implement these big programs. They want support to be successful. Show them how they get there, right? Pour into them a little bit. They want a challenge. It's great to challenge young people because it's going to drive them away or pull them closer. And sometimes, Zappos used to have, the company, they used to have a program where after 90 days, they would pay you $3,000 if you want to quit. Boy, that's extreme. Imagine paying someone so they can quit. Zappos really turned it on its head because they want to challenge you to know if you're there for the right reasons. I'm not saying that's the right fit for everybody, but I'm just trying to paint a picture, right, as to how some organizations do it. Lastly, they want to thank you, right? So some other inexpensive perks here as we start to wrap up: healthy cafeterias, corporate branded swag. This is marketing, right? As your people wear those swag outfits out into the community, it's continuing to get your name out there. Team bonding events. These can be cookouts. These can be hamburger, hot dog, come meet at the park, bring your kids, small things, right? Career planning sessions. These are free. You don't need anything to sit down with somebody. And that's where I want to take this because nobody wants to spend much money on these things that drive results. So giving individual attention, providing training, providing coaching, listening. Boy, is that hard to do sometimes as a leader because you always want to tell them what the next thing is you need from them. Slowing down and listening, getting social, right? Sometimes removing that barrier where I'm the boss and you're the employee and I can't get too friendly with you because it's going to make things harder later. It's a fine line, but it's a way to build that engagement. Serve your employees, recognize proudly, right? I always say praise generally, criticize privately, right? Don't criticize somebody in front of their peers. Boy, that will turn them away quick. So what are some things that you can continue to do? You see the screen here, encouraging these positive health and wellness, setting goals with your employees, continue to perfect that onboarding process and thinking of your employees. These are all things that you can do to impact engagement. And that's where I'm going to wrap up. Hopefully there was a few takeaways and nuggets for you as you're continuing to refine your process. But I want to pause there and just see what kinds of questions maybe we have, things that I can answer for you, and ways that we can continue to help each other get better.
Awesome. Thank you, Vince. Definitely some great takeaways for sure. One question coming in was, can you talk a little bit more about the impact of mentorship, especially looking at recruitment? I kind of had the same question too, and maybe thinking about identifying that right mentor in a, stressful, hard situation where they have a lot on their plate already, what goes into that, that process and how valuable that can be.
There's some great tools out there that can provide framework. I think in regards to mentoring, you want to make sure mentors are assigned to people who are like them. So don't assign the oldest woman on the floor with the youngest male that's a new hire, because they're going to have some just foundational differences in the way they view things, right? So you want to try to identify those leaders who are willing to take on a little more. You want to try to give them structure so they know where they can assist the new hire. Week 1, where do I put my lunch? Where do I hang up my coat? Where do I park? How do I sign in? Week 2, it's how do I log into the EMR? How do I do X, Y, and Z, right? So you've got to provide some structure so each new hire and mentor knows what's important through that first 90 days. And if you can do just those couple things right, you'll find that the mentor is going to have a little more direction. And again, helping them realize, and oftentimes it's just almost reminding them, hey, somebody's depending on you to help them. Just take 5 minutes before you go to lunch and go check in on them, right? Sometimes just those subtle reminders to the mentors, because they say okay to take on the role, and then the job gets so busy and they are probably overworked that, it's hard to justify going to check on a mentor or a mentee, when I've got patient care in front of me, which I think we all know trumps so many other things. So it is very difficult. There's programs you can use to provide that framework. And again, happy to dive deeper into that afterwards if we want to talk more.
Perfect. Yeah, we had one piggyback question to that. Should that be part of the job posting, kind of going back to Julie's part of the presentation?
Absolutely. If you're going to provide mentorship, you darn well better be bragging about it, because that's a huge plus for me if I don't have to be alone learning something. If I know coming in that you're going to support me, you're going to support me with quarterly goals, your community does things that are amazing, and boom, I get a mentor day 1 who's like me, who's going to show me the ropes and be there. Yeah, I'm way more interested now. So definitely part of that job posting, if you've got the program in place and you can deliver, because we also want to manage expectations. If you tell people up front, boom, we've got a great mentor program, and then they come in and goes, well, we stopped doing that a year ago because COVID. Well, that seems a little misleading to me, right? Now you're starting to lose my trust. So you've got to be very clear and on point with those expectations and what it will ultimately provide.
Great, thank you. Any last minute? We're at the bottom of the hour here, so I'll respect everyone's time. Any last second questions here? Tom says, great presentations, Julie and Vince. Thank you. Yeah, thank you both. Thank Julie and Leaderstat, Vince and Relias, George and Chisholm. We appreciate the opportunity to help put these two or 3 groups together and make sure that we're trying to address a serious concern that's out there. So we're hopeful that you have some great takeaways from today. Natalia and myself will be following up with you directly. I think we have a good list of who is on today, just to make sure that you're getting what you need. If there's any follow-ups, certainly should you have any questions outside of that, please let us know, and we want to be able to help connect you with the right information, the right vendor, the right resources to try to make your life a little bit easier in a challenging climate. So George, thanks so much for your coordination, and we'll let you guys get back to your busy days. Thank you.
Thanks everyone for coming. Thanks to Julie and Vince for presenting, and for Natalia and Quinn for putting it together, and for everybody for attending. I think that there was a lot of food for thought, even if you were in a different area of ministry than skilled care. I thought there were really good suggestions here. So thanks again. We'll look forward to seeing you again soon, and we'll stay in touch.
Thank you.
Absolutely. Thank you so much. Bye, everybody.
Bye.